Hello, everybody. My name is Ghassan Abou-Alfa from Sloan Kettering Cancer Center, New York. Nice to connect again through the VJ Oncology, and really great delight to really reflect on the nice work that we have seen in the hepatocellular space at ASCO. The focus is going to be on the part of the work that we proudly contributed from Sloan Kettering. And if anything, we were honored and I was delighted to really reflect on what I now call enhancers. As we know, the use of the checkpoint inhibitors being either as a base plus an add-on like anti-VEGF or now even with dual checkpoint inhibitors, where else we can do better than that? And this is really where the enhancers come in. And there's been a lot of excitement and a lot of interest in regard to the anti-TIGIT. And I have to say, this is yet to really prove itself 100%. But so far, what we have seen from the MORPHEUS-HCC study that was presented by my dear colleague, Dr. Richard Finn, which I was asked to really comment and reflect on. If anything, we know mechanistically, yes, the T-cell immunoreceptor of immunoglobulin and the ITIM domains, or what we call TIGIT for brief, has like four mechanisms in regard to enhancing its potential for anti-tumor activity, and that's really where the anti-TIGIT come into play for that purpose. Interestingly, the study looked into as a first primary endpoint for a combination of the standard of care therapy of Atezolizumab plus Bevacizumab plus the Tiragolumab, which is the anti-TIGIT. And it showed really impressive response rates, enough that really people, have the right. And I'm one of them, is like to really get excited about that data. And then they pushed the envelope further to see what the PFS would be. And I don't know, as I said in the studies, in the comments as well, I think there was no necessity from my perspective to really push to say, how does it compare regard to the IMbrave152 study? And if anything, to kind of like even do this kind of, hybrid control to try to really make more out of the data and try to find a reason why and to explain why the add-on of TIGIT fared better, but at the same time, more importantly, the Atezolizumab without the anti-TIGIT did not fare as good as it did fare in the IMbrave150, and they're trying to find an explanation for that purpose. To be fair, I wouldn't really worry much about that. It's a different setting after all, and there are certain variables, and there's a certain laxity regard and a bit more comfort regard to the combination per se. I think the focus is going to be more, is it really the right target? I spoke quite a bit about the use of anti-TIGIT in lung cancer, or at least the test of lung cancer. And I think I commented on yet the still no satisfaction regard to the anti-TIGIT, which, by the way, we know they're being tested in at this number of studies in non-small cell lung cancer, same like with other malignancies, but not there yet. So I would say the enhancers, yes, probably could have a role, but we're not sure yet what it means. Remember, not only the anti-TIGIT, but there's like 3 and others. And it could be that we need more than one of them. We're not sure yet, but time will tell.